My general practitioner had asked me months ago to come back and do something more aggressive with my cholesterol levels. And I ignored it for most of a year and started having an achy chest. And I don't know why, but you're just compelled to believe at first that it's not really that. I don't think I confronted anything very seriously until that first Friday night when I was sitting on a chair at the front door waiting for the ambulance to arrive. Over the total course of time, I spent about 9 days in the hospital, and I never met anyone in the Mercy Health system that I didn't think projected a very real concern for my health and even for my comfort. I think that the Mercy system sitting here in Janesville is a jewel that hopefully the whole community can recognize. It is a tremendous facility. In healthcare, that's number one. Am I getting good health care? Am I going to be healthy? But those don't tend to be the things we talk about. We talk about, I waited at that clinic for 45 minutes, or I was in the emergency room for 2.5 hours. I didn't see any of that. I saw a secretary receptionist that was concerned that I come back up to the desk if nobody's seen me in 10 minutes. I remember a specific nurse, Kathy, that said something to me like, I hope you haven't been waiting more than 5-10 minutes. No, in fact, I was early and only waited 5. Okay, good. My health is number one, and you don't have to sit around and wait for 3 days if that's what it takes. But it's nice that you've got an organization, a system, and people that know that bothers all of us. A minute of my life is worth just as much as a minute of your life. So, don't keep a schedule that makes me sit here and wait. Do what you can when you can anyway. My comfort was a concern. I've told anybody that's asked me, well, where did you go? What happened? I tell them, thank goodness I went to Mercy, and I don't want to go anywhere else again. I think that as residents of Janesville, and this is what I've expressed to people, I think, I've tried to, is that as residents of Janesville and surrounding areas, I think we're very lucky to have the ease of access that we do to the Mercy Health system. And I thinking about it, and I'm thinking, these are my neighbors, they're my friends, maybe even a relative or two. That is Mercy. It's our neighbors and our friends, and we can be really proud of that. Mercy's right here, and it's in outlying communities. And that makes us, I think, as residents local to this area, very lucky. From what I've seen of Mercy, I don't have to travel any further. You know that the people that are there are professionals, you know that they're committed, and you know that if anything can be done, these people are going to do it. I do have a wife, I've got 6 children, and I've got 6 grandchildren, and they all mean a great deal to me. I want to be there for them. I've thought more since Mercy gave me my life back about wanting to be there for them than I ever thought about before. I think they need me, and I know I need them.